Bismillahirrahmanirrahim. I'll be talking for early childhood development, parenting care package and the framework. So first of all, we will see that what's the relation between early childhood development and what are the key family care practices which the parents needs to adopt. My job is very easy when Professor Junaid Rashid has already talked about responsive caregiving, early stimulation, nurturing care framework. I'll also be talking about, because this early childhood development is just not the health and nutrition specific, it's also the multi-sectoral business. It is early childhood learning, it is provision of the water sanitation services and provision of the child protection and the child rights services to the child. So this is a very comprehensive concept which we need to develop and which need to be, inculcate in our policies and programming. So first of all, what is early childhood development? This is the process of maturation and related with the growth from the conception till 8 years, starting from the physical development till motor development and the cognitive development of the child, linguistic development, and also social and emotional and self-regulation skills which start from the conception. The first phase of child life is the conception till birth, which is very important when we talk about the brain development of the child. And when we talk about from birth to 3 years, there are specific interventions which are very important. From the birth, the infant and young child feeding is important. Early initiation is important. And you have seen in the previous presentation that how breastfeeding is strongly connected with the early development of the brain and the neural connections of the brain. And then it is the 1000 days are important, and 1000 days starts from conception till 2 years. Why is it is important? We'll talk later. And then starting from preschool, this is 3 to 8 years. These are important for and connected with the early years of child life. And ECD is the process of the development of the cognitive, physical, language, socio and emotional development of the child. And we have seen what is the age. If we see that development is just not an individual process, it has a strong relationship with the environment, in the interaction with the environment where child interact. It's the mother, it's the father, it's all the caregivers who are involved in the child development process. A healthy and the stable environment helps in the brain development, and it also stimulates the neural connection, because at the 1000, why we say the 1000 days of child life? Because that is the time period when the connections of the neural connection is on the high peak. In the early years, from conception till 9 months of the child life, the speed is 1 million neural connections are being made, and the speed is so high. And the key aspects of environment is nurturing care. This nurturing care is basically responsive caregiving. It is early stimulation, connection and bonding of the child with mother, connection and bonding of child with father, and also all the caregivers. Why it is important? What is important? It's just not, we need to see why it is important that कि माँ ने बच्चे के रोने से पहले ही आइडेंटिफाई कर लिया कि बच्चे को भूख लगी हुई है, क्योंकि बच्चा डिफरेंट सिग्नल्स से बताता है कि उसको भूख लगी है. एंड देयर आर सिग्नल्स जो कि माँ बताती है. जब बच्चे को भूख लगती है तो माँ की मिल्क डिपिंग स्टार्ट हो जाती है. सो दिस इज द बॉन्डिंग एंड कनेक्शन जो कि माँ और बच्चे ने अंडरस्टैंड करना है. दिस इज ऑल्सो, एंड देन जस्ट इट्स नॉट द ब्रेस्ट फीडिंग इज इंपॉर्टेंट, इट्स कडलिंग, इट्स टॉकिंग टू द चाइल्ड. हमें ये लगता है कि बच्चा जब बहुत छोटा होगा तो उससे बातें करने से हम क्या अचीव कर लेंगे. that is the हम ये कह रहे हैं कि जब बच्चे की न्यूरल कनेक्शन जो है वो बिल्ड हो रही होती है, so that's the time जहाँ पे उसकी कॉन्फिडेंस और उसकी पर्सनैलिटी की सारी एट्रीब्यूट्स जो हमें डेवलप हो रहे होते हैं. So that's nurturing care in total. What science says about early moments and why early moment matters? Because in the first 1,000 days of child life, the brain sparks new connections. And at this time, as I mentioned earlier, the speed of the neural connection is 1 million per second. And they contribute to the child brain function, IQ development, learning of the child, and also that is the time when the child foundation of the life is laid, that all process is dependent on the child happiness and the future life. कि बच्चे ने कहाँ पहुँचना है, that is what, ये माँ की गोद है जिसने decide करना है कि बच्चे ने कितना achieve करना है अपनी life में. This is what holistically early childhood nurturing care framework. They build the brain. Why it is important and why it is related with the brain development of the child. More than 1 million neural connections that are, that processes started from conception till 1 year of child life. And over 80% of the baby brain is formed by the age of 3. And up to 70% of each meal goes to building the brain in early years of child life. And the 15 minutes of play can spark thousands of the brain connection. So that is why cuddling, play, talking to the child is important. We can see here that the brain develops very rapidly in the first 2 years of life. And that's not only developing the physically, but also this is actually cognitive development, IQ development of the child. And early language skills and higher cognitive functions develop from, if we see the study, which is it's the study of neurogenesis, the major development and the vision and hearing and the language and higher cognitive functions develop from the birth to 9 months of the child. So that's the peak when the child achieves major IQ development, cognitive development, and also develops the language, linguistic skills. That's another study which shows another opportunity of child development. This is from 0 to 4 years, which is preschool and the school years. If we see, the major development happens in the first 4 years of child life. And the important, when the neural connections are formed, and this is actually the early years of child life, but from birth to 2 years are very important. Why the early years matters and why it is important for lifelong health and well-being of the child? Because of the development of core immune system, metabolic regulations, and it has a strong link with breastfeeding, and psychological systems of the child. And these are all functions which decide the adulthood of the individual. There are 3 major pillars. One is early experience from birth to 3 years. And another important pillar is this supporting the parenting care for child development. So this is just not the mother, but also the family members. The father support is very important. And the nurturing care framework emphasize on the role of the father. And quality of early education and early learning is important. There are 5 very important messages which are related to early brain development. The first message is very important. This says that gene is very important, the DNA is very important, but what shapes it is the environment. So that is why early stimulation and nurturing care and responsive caregiving is important. So the relationship between gene and environment is closer than ever before. And gene provide the blueprint for brain development, and the environment shapes it. And this is a very important message. And this relates to Professor Junaid's thing that हमारी माएँ आके कहती हैं नहीं इस बच्चे का तो बाप छोटे कद का है तो इसका भी कद छोटा होगा. नहीं. The environment matter, the food matter, the stimulation matter. So we can change it. And the message 2 is timing matters. If we invest on early years, then we win the game. Otherwise, we miss the boat. And the message 3 is toxic stress during early childhood impact the lifelong. And message 4 is brain complexity. It's not homogeneous, but interconnected. This is why we need to work together. And message 5 is nurturing the mind with adequate nutrition, with adequate stimulation. This is the whole message. The food alone is not important. The early responsive caregiving alone is not important. This is interconnected and integrated interventions need to be delivered for the child life and the child development. If we see why investing in young children development is important, because 43% of our children are at the risk of malnutrition, at the risk of diseases, and at the risk of developmental issues. And if we see the neuroscience studies, which says that early childhood is critical, and this is a critical window of opportunity to shape the brain of the child. If we can see the data from all over the globe and South Asia and Pakistan, the overall 43% of the under 5 children are at the risk of development. And if we see the South Asian region, 53% of under 5 children are at the risk of malnutrition and developmental issues. But if we come down to Pakistan, we are even higher. We are 63% of children, which is 12 million children under 5, are at the risk of developmental issues and malnutrition. And we all believe, as the expert, in the area of child development, we all believe that this is the child right, and it's basically important for the foundational development of the child, and this is very important for achieving the sustainable development goals. Yeah. This is the statistics which says that what is the situation globally, and then what is the situation at the South Asian region. And also in Pakistan, if we see 40.2% children are stunted and 17.5% children are wasted, according to National Nutrition Survey. This means that we are far away from achieving the sustainable development goal. If we see the health situation, child mortality is 74 per 1,000 live birth, and infant mortality is 62 per 1,000 live birth. So, and with 66% of immunization coverage, we are aiming to achieve the sustainable development goal. And if we see Pakistan water sanitation and hygiene situation, 15 million people are not accessing and have, are not having the defecation facilities. And access to safely managed clean water are just 36%. And Pakistan learning situation, we are the country with the highest proportion of children with learning poverty. We are the second around the world, and 75%, after Afghanistan, which is 93%. And if we see the Pakistan child protection area, we have, child marriages 18%, birth registration 3%. So these are the 4 multi-sector which are major contributor for the child development and child early development. Why nurturing care framework is important? Because it's the holistic framework which is important for the development of child from the birth till 8 years, providing the adequate nutrition, providing the responsive caregiving, and safety and security of the child. This is very important. And then opportunities for early learning, and of course the good health. If child is, in early childhood time, if child is faced with the violence and, neglect, this child will not be able to achieve the outcome in the school. And what is important is providing, this is important, good health, adequate nutrition, safety and security, and responsive caregiving. This is important for the child to survive, thrive, and achieve their full potential. Okay. Continuum of care and what are the key platform? The important key platform is conception till, this is during pregnancy, till the age of 3. And from age 3 to 5 and 6 years, and from 6 to 8 years. This is important. This is age segregation. The first age segregation is basically, conception is related to the mother's health, which is part of 1000 days, where maternal health and nutrition matters a lot. And then at the birth of child, that early and infant and young child feeding is important. At age 3 to 5, this is the area which is related to education. And age 6 to 8, it's education, water sanitation, and also adequate nutrition and health. Nurturing care is an input which includes responsive caregiving, adequate health, good nutrition, early education, and saving the child from the violence and neglect. And early childhood development is the outcome which we aims to achieve. Thank you so much.